Hello, my name is Jonathan Parks. I am a student at Oakland University in the Department of Nursing. This video presentation is for NRS 4571, Contemporary Nursing, Professional and Ethical Issues. The practice change I am going to discuss today is workplace safety and nurse staffing as a clinical setting need. Today is 4/18/2026. I have had an interview with my colleague, hypothetically, and we're discussing a significant necessity in our work field. In the interview, we discussed the impacts of staffing difficulties, workplace pressures that are placed on the nurses and the patients. My interviewee said that in case of short staffing and unstaffed staffing ratios of the unit, nurses seem to be overworked. They have less time to teach their patients and provide education and feel the pressure to get things done in a short period of time. This may be a source of stress, low job satisfaction, and difficult time delivering the safest and most efficient care, according to my hypothetical interviewee. The interviewee would have mentioned that I would like to list in this presentation as a personal communication that in their personal experience, nursing burnout does happen very fast if you are experiencing these types of work environments. We settled on the fact that this is one of the practices and educational requirements since it influences the well-being of the staff, communication, and patient outcome. The problem has a direct impact on bedside nurses, but it also has an impact on patients, families, nurse leaders, and the health organization in general. In cases when nurses are overwhelmed, there's an increased risk of care being missed, delayed, and leading to burnout, as we stated before. The given reading also highlights the fact that patient safety is intimately related to the workforce safety, and that healthcare institutions must have a system in place to address the physical, psychological, and emotional well-being of their employees and patients. Following our discussion, we came to an understanding that I would continue my research on the ways of enhancing workforce safety and minimizing the adverse consequences of staffing stress in the clinical environment. One way to meet this requirement is to have a presentation or teaching tool that will inform the staff and leadership on the connection between staffing, safety, and quality care. As an illustration, an example of a brief instructional presentation can be the overview of warning signs of unstaffed staffing ratios on how to report their issues and evidence-based practices that can ensure nurse support and patient protection. The preparatory article also suggests the use of systems approach meaning safety measures and leadership accountability, which might be included in the teaching tool. That would be my presentation, the conclusion of my presentation, and thank you for your time. Have a great day.